Today, I have with me Dr. Naren Nayak, a leading neurosurgeon from Mumbai KIMS Hospital, Thane. Welcome, Doctor.
Thank you.
Dr. Nayak, you specialize in DBS surgeries for Parkinson's. How does this work?
So, Parkinson's disease, as we know, is a chronic illness which is neurodegenerative. So, over a period of time, patients are treated very well with medical treatment. But some years down the line, you will find that these medicines are either inadequate or not producing sufficient results. So, ultimately, a stage may come during the illness where the patient is taking large dose of medications and yet not getting the benefit that he desires. So, in such patients, we offer a surgical solution we call Deep Brain Stimulation. Now, Deep Brain Stimulation involves placement of a pacemaker and electrodes in the brain which supply electrical stimulation to specific areas of the brain. And these help in solving some of the motor complaints that these patients have, mainly stiffness, slowness, and shakiness, or what we call as tremors.
So we understand from doctor that how DBS surgeries can help the movement of a patient. If you want to have an opinion with Dr. Naren Nayak, ping us right now. He is available at KIMS Hospital. Generally, patients are fearful to undergo a brain surgery. So in this case, is there any other option available to the patients of not going the surgery and still being treated?
So now we have the option in certain cases of tremors and other movement disorders. We use focused ultrasound waves similar to what we undergo in an MRI machine. The patient is placed in an MRI machine and ultrasound waves are focused on specific areas of the brain. So in select cases, even without undergoing surgery, patient can undergo treatment for certain conditions like tremors and dystonia.
Understand that if there is a movement disorder, without surgeries also, patient can be treated through this LASIK method, right?
Yes. So basically it is use of a technology called magnetic resonance guided focused ultrasound, where just like we undergo ultrasound examination for various body problems, we can use this technology, we can use the ultrasound waves and concentrate them in certain area of the brain, and they produce heating and they produce a disconnection of the abnormal circuits. So this helps the normal circuits to take over and the problems that the patients have are taken care of.
Dr. Naren, in some cases I've seen some elderly people also, while drinking water or putting something, they have this hand tremors. Is it connected to the brain?
So tremor is one of the most commonest complaints. We see it in our families. So it runs in some certain families also. And with aging, naturally, we notice it. So we tend to ignore it. In our society, we tend to ignore tremor and somehow manage with it. So all the problems of tremor are related to the brain. So the fine circuitry of the brain, which controls movement, gets disturbed as we age. So this tremor is one of the outcome of a brain dysfunction. And it may vary in severity, it may be very mild or may be severely disabling so as to render a patient completely incapacitated. So even for a glass of water, even to have their own meal, they are dependent on others for getting this thing done.
So if we are finding our elders or anyone in the family having tremors while doing their small activities, please do not ignore it. Consult your nearest neurosurgeon as soon as possible. If you all want, you all can ping us to have an opinion with Dr. Naren Nayak at KIMS Hospital. Dr. Naren, people tend to, regular headaches are there, dizziness is there, and people tend to ignore it or just take an eye checkup. And then after that, they tell, no, I've done everything, can be sinus. And after that, they've left. But still, this carries on. When do you is it related to anything, to any neuro problem? Should they consult a neurosurgeon? What should they do? What their next step should be?
So, headache is one of the most commonest complaints we have in society. And I agree that most common cause of headache are tension headache or migraine headaches or medical cause of headache. So, Usually they are treated with medicines. But you know, we should be worried in certain kinds of headache. There's a profile of headache that we should be aware of. Headache that has been there for a very long time. Headache that is increasing in severity. Headache that is requiring regular use of analgesic, maybe 1 or 2 a day. Headache which is more in the mornings. Headache which is associated with vomiting.
Okay.
Headache which is associated with, blackouts or visual complaints.
Mm-hmm.
And headache which is just not going away. It's been there for a couple of weeks. In such cases, probably it is worthwhile consulting a neurosurgeon, to evaluate it further to make sure that we are not, missing out on a treatable cause of it.
This is the highlight that doctor could give on regular headaches, that when we should connect with a neurologist. I think this was a very insightful answer, and it would help us to understand, evaluate our own selves for better lifestyle. Thank you, Dr. Naren, for your presence here with us.